Tonight at 11, we start with the upcoming vaccine mandate deadline on Monday for healthcare workers. Good evening and thank you for joining us. I'm Leanne Stock. Governor Kathy Hochul has now put the vaccination rate at 84% for hospital staffers in the state. So she says Albany is seeking ways to counter a potential shortage with the other 16% who may not be allowed to work with the vaccination. Tune your eyes. Ron Plants joins us now with the latest. Ron?
Compared to some other Western New York hospitals, Niagara Falls Memorial Medical Center is in pretty good shape with a 93% staff vaccination rate and will keep services intact unlike some others. But its president still has overall concerns with patient care, the pandemic, vaccinations, and now mandates putting jobs at risk. A perfect storm, as they say.
You still have a certain segment of the various professionals that are not willing to get vaccinated. So it just compounds a problem that had already existed.
That problem, a shortage of qualified, experienced healthcare staffers like registered nurses to begin with before COVID, and it pushed many near retirement age to get out sooner with the age infection risk and increased workload. Governor Hochul wants to address it with ideas like using medically trained National Guard units and request for federal disaster medical teams, even though their numbers are limited. Also, more healthcare staff brought in from other states and countries, but that could be more costly for hospitals and difficult with visas. Then urging or offering incentives for retirees to come back, easier said than done, and speeding up accreditation for recent nursing school graduates. However, many of those grads had strictly remote learning with the pandemic.
They really didn't get a chance to do their full labs or their full clinical rotations at hospitals. And so they're actually requiring a lot more training than usual with respect to orientation so that they can actually be on their own taking care of patients.
And how about rehabilitation facilities or nursing homes with only a 77% vaccination rate, according to the state, especially for certified nursing assistants who also face the mandate? Ruffalo says those facilities may limit new patient intake or cut their bed count with their own staff shortage concerns. So for hospitals,
we may see more long-term care patients occupying hospital beds because they can't be placed in a nursing home, which then would have a ripple effect on the emergency room because you'll have medical admissions in your emergency room that can't make it to the floors because those beds are occupied by long-term care residents.
Ron Plants, Channel 2 News.